Welcome, everyone. Thank you so much for joining our session today, where we present Re-envisioning StudyFinder to improve health literacy and engagement in research. So super grateful that you're all here, excited to learn from each other today and see how we can improve StudyFinder. See, a few people are still filtering in, so Paula will kindly let them in. And we'll get started. So this is being brought to you today through our CEnR program that stands for Community Health Equity and Engagement in Research. And these are the wonderful colleagues I get to work with every day. We're so glad you're here. I'm Jen Poger. I'm director of our Community Health Equity and Engagement Initiative, otherwise known as CEnR. And I also have been partnering with Stephen Negron Candelario from our ASAP program, and that is our Accelerated Staffing Assistance Program here through Penn State CTSI. So we recently came on board to StudyFinder and the volunteer repository within the past few months to try to make this a more inclusive tool. And we thought it would be very useful to first find out from all of you what's working, what's not working. And we've also leaned on some of our other CTSA partners, our clinical and translational science awardees across the network with NIH to learn how they have implemented StudyFinder and the volunteer repository at their sites. So we've learned a lot, and we're here to bring with you some of these wonderful ideas and also see how we can make this even better for you. Just some basic logistics. The presentation is being recorded because we do often have several people who unfortunately don't make the session but do sign up. So we want to make sure that they're able to learn from this important information shared. Please raise your hand to ask questions. This session in particular will be very interactive. So we certainly want to hear from you, and I will be posing several questions throughout the session today. You can raise your hand or use the chat feature to make comments, share any thoughts or resources, and of course, make connections with your fellow colleagues. Presentation materials with the video recording will be shared post-session. So I'm going to first launch a poll just to kind of see where things stand in terms of your utilization of StudyFinder and also the volunteer repository. Okay, we'll go ahead and end the poll and share the results. So this is quite exciting. A little more than half of you have used StudyFinder as a recruitment tool, so that's wonderful. I would love to hear what has worked and what hasn't as we go through this presentation today. For those of you that haven't used StudyFinder, no worries there. It's actually really nice to get that keen awareness and an objective lens to kind of see how this tool might work for you. And it looks like the majority do not know what the volunteer repository is. So you will certainly know what it is by the end of today's session and how we can make it a more robust tool for recruitment. So StudyFinder was originally launched through the University of Minnesota through their Clinical and Translational Science Institute. We have wonderful colleagues that we've made at that CTSI to learn from. In fact, a few of them registered today and maybe on the call, so welcome if you are. And really, they were the pioneers in developing this tool as a way to reach potential research participants for research opportunities. So it can be certainly very helpful to increase awareness to research and try to attract the intended population you're hoping to reach. We brought it to Penn State several years ago now as an additional recruitment method for our research studies. So for those of you who have used StudyFinder, what are some things you want to initially share about it before we get into the real granular details of what's working and what's not? And Stephen is on the call, and he's going to help field any comments or questions or any hands raised that you might have to start our discussion today. Stephen, why don't you go ahead and introduce yourself? I want to make sure that you have the opportunity to do that as well.
Yeah. Hello, everyone. My name is Steven Neron Candelario. I am a member of the CTSI of the Accelerated Staffing Assistance Program. I also had the pleasure of working with CHEER during my internship, where a lot of the work that we did focused on sort of the volunteer repository and StudyFinder. So this is both a passion project and a work project, and I'm really excited to hear about how we can sort of develop this tool and make it a little bit more useful both to researchers and our community. And I see that in the comments, Shalise said it seems to recruit a lot of people who don't fit the criteria, which is one of the things that we're trying to address. Shalise, can you tell us a little bit more about your experiences with that, if you're able to?
Yeah, so I do studies with people who have aphasia a lot. And a lot of times I'll get people who don't have aphasia emailing me about a study. I do a lot of studies with older adults. I'll get students emailing me about studies. I do studies with people who are bilingual. I get people who are monolingual emailing me. Like, it just seems like it's everybody who doesn't fit my criteria are the ones who actually email me about this study.
Yeah, for sure. That definitely happens. And I think we, in our Re-envision 2.0, there's some considerations that we can make with regards to better stratifying so that the people that end up contacting you are more closely eligible to your particular project. So that's something that we certainly are keeping in mind. I also just wanted to share that this was led through Dr. Neil Thomas, who I believe is on. So Dr. Thomas, I don't know if you just want to say hello if you're available. This was really shepherded to bring this here as a recruitment tool under his leadership. So I wanted to just make note of that.
Sure, thanks. Happy to be here. Happy to see, this get as much publicity as it can. We started back in 2016 with a pretty basic version that just picked up information from clinicaltrials.gov and quickly found out that it really wasn't what we needed. So we made a lot of changes and the integration with CATS IRB, which really improved it. And now taking the next step and trying to develop the volunteer database. The thing we need is really feedback. We need to figure out what's working, what's not working, so we can make changes. So hopefully we can get that. Thanks.
Thank you so much. So I'll share here, this is for those of you that might not be familiar with StudyFinder. When a potentially interested participant goes to the database, they can select if they're a healthy volunteer or not. They can put in their gender, and if they're looking for in-person participation, the location where the research may take place, and some other information here. They can just do a general search, or they can look based on these conditions that have been listed here. And you can kind of see those numbers. So Cancer has 117 active research studies within the StudyFinder database that are currently being advertised for. So it's a way to really just filter out the studies that may be of interest to the person who's searching on the database. So just in looking at this list, do you see any gaps in study categories provided?
Jen, is there a way for you to zoom in a little bit on your slide at all?
I cannot, unfortunately, because I'm in screen share mode, but I will. Well, let me see, actually. No, that went the wrong way. Maybe I can. Let's see here. Oh, I can. Is that better?
Yes, much.
Okay.
Thank you.
I didn't want to mess anything up, but no, my eyes certainly need it as well.
Thank you.
And I'll pose this a little bit differently. For the research that you're doing, could you easily fit it into one of these categories? And there's meaning behind my question, so please share.
Sorry to interrupt, Jen. Katie said she's having trouble raising her hand. Katie, are you able to speak, or would you prefer to just let us know in the chat?
Sorry about that. I'm like suddenly cannot work Zoom. I need another tutorial. Imagine that.
Oh, good.
No, I just wanted to share our experience here in our unit. So I'm in the Department of Kinesiology at University Park. And we actually were visiting this topic a couple of years ago, like how could we leverage StudyFinder to help our faculty and grad students better recruit into our studies? And we actually worked pretty closely with some of the developers in StudyFinder. We talked about this exact topic, how kinesiology is such a diverse discipline or has many disciplines that nobody felt like they fit into any one thing, the research couldn't be found. And so one thing that I don't know that everybody knows is that you can actually search by department in the search bar. And so that was a feature that came out of that discussion with the StudyFinder folks. So what we do is we post a link around a QR code around our department to say, find all the studies going on in kinesiology, and it links to just the studies where the PIs are from kinesiology. It's a start. I mean, it's not perfect, but that's one way that we've gotten around the fact that this list of conditions could be triple the size to try to fit everybody's research. The one thing I will say is that over time, if someone is in Google Chrome browser, the link will break down and you have to clear your cookies. And I don't know how I would put that under a QR code. Like, if this isn't working, clear your cookies. So that I think that's a known issue as well, but that's just one of the things we've run into. But yeah, just sort of a tip for folks if they haven't tried that yet. You could try searching your department and see if it comes up.
That's such excellent feedback, Katie. Thank you for sharing that. Stephen and I, as we mentioned, have just been on this project for a few months. So I was not aware that that was a feature, and that is really good to know. That's definitely one way to combat having this list be so exhaustive that it's really hard to find research studies because there's just too many options. And yes, that clearing the cache to get to the website after so many times is an issue that we've been seeing as well. So something that we do need to address in this version 2.0. I asked specifically about these categories because when we have interviewed other CTSAs, they do have it broken down a little bit differently. So it gives us an opportunity to sort of revisit what these categories look like, and if we do want to make them a little bit more expansive, but balancing that with having too many.
And some people in the chat have actually made a good point, Jen, talking about how healthy volunteers should maybe be a category. Do you want to maybe explain a little bit about how we divide the healthy volunteers versus those looking for a specific study?
Sorry, Stephen, was that a question for me?
Yeah, sorry.
Sorry. I didn't
Okay.
think anyone had thoughts on that. Yeah, so you can when you go to the homepage of StudyFinder, you can select that you're a healthy volunteer and then search for opportunities that come up based on what is recruiting for healthy volunteers. But I kind of like having a button here. I think that might be really nice for folks, and we can pull those studies into that bucket just so they can have a snapshot of healthy volunteer, there's 70 opportunities for me. Let me go that way and look through them. So I think that's really great feedback. So the volunteer repository, a majority of you are not familiar with, so I will give some context to that. It launched a little over a year ago in June 2023, and this was an effort that really brought together multiple departments and institutes across the College of Medicine. So CTSI, the College of Medicine, in partnership with College of Medicine IT, the Institutional Review Board, and the Penn State Cancer Institute, among others. So we established this governance across multiple departments. A huge shout out to Erica Francis if she's here. She's our CTSI administrator who really shepherded the implementation of the volunteer repository within StudyFinder. And the goal is really to connect more people to more studies more quickly. So the flyer that you'll see on your left-hand side is really a way to advertise for this volunteer repository mechanism. Every CTSA that has a StudyFinder implementation doesn't necessarily have the volunteer repository implementation. And that's what we learned when we surveyed several of the different groups that we met with. But it is something that several are looking into as a way to connect participants to research opportunities. So we'll talk a little bit about what that looks like. So the data that's collected This, did have to go through an IRB application in order to have some type of consent form for the potential volunteers who go to the volunteer repository within StudyFinder to sign up to learn more about those research opportunities. So demographics such as date of birth, gender identity, and race are collected, along with contact information and areas of interest that they might have. So StudyFinder has several benefits to research. We know that it has the ability to improve research awareness, and it has the ability to tailor to studies of interest and increase likelihood of engaging in future research opportunities. What do you think are some other benefits of StudyFinder and this potential volunteer repository, which really is a mechanism for volunteers to more quickly find out about studies that pertain to them based on their selected interests? So what do you think's working? And for those of you that have for the first time heard about the volunteer repository, what do you think of this idea to have a place where potential study participants can more readily learn of research opportunities that match their interests? Is that something that, now that you know about it, would you want to implement in your research or among your potential research participants? Go ahead, Ben.
Yeah, I think it's a great idea. Like, I like the idea of like having volunteers or participants coming in and then having access to saying like, or from the researcher's point of view, like saying like, okay, this professor has had this participant and they look like that participant might fit my study too. Can we reach out and contact them to help recruiting and those sorts of things, to kind of have like that interdisciplinary, like cross, kind of thing, and try to like foster an environment, especially in community, that like embraces science, embraces studies, and wants to continually volunteer for different studies and things of that nature. So I like that goal. Like I think that's a really good goal to shoot for, to try to have this environment and community all kind of like be constantly interested with helping.
Excellent. Thank you so much for that feedback. And you got at community, which is something that we're going to be talking more in depth about, and this idea of research inclusivity. So how are we getting out into communities to continue to demonstrate trustworthiness in research and engaging these communities in research opportunities? Maybe not a particular study that we take to a community will be something that all of the people that we engage with at that time can sign up for, but letting them know that there are so many wonderful research studies taking place at Penn State kind of opens up a beautiful vessel for them to find out about more research opportunities. Looks like Jody has her hand raised.
Everybody, my name is Jody Matthew. I'm in the IRB office. And so I like the idea. I'll tell you from my opinion and an IRB stance, with having one voluntary repository that everybody could use. We see a lot of submissions, and I like what Ben was saying. We see a lot of submissions where this researcher has their own contact list in their lab, but then this faculty member over here hears about that they have this list, and so they want to get them, but they might not have gotten permission from their former subjects to share that information more broadly outside of their lab. So if we have something like this, we might be able to combine all of that information, and then in an IRB protocol, when it comes to recruitment, they say, we're using the voluntary repository thing too, and StudyFinder to do this. And so having those procedures already approved, I think, would make it beneficial to everybody involved. And so I really like the idea. And when we were approached about this voluntary repository, it would be great if everybody was using it and we didn't have these little individual silos of things that we could spread the wealth, and people may be interested in participating in different types of research.
Yeah, that's such an important point. And Jody, we might call on you in a little bit as we talk about some other IRB implications and ways that we might be able to facilitate a little bit more of a user-friendly approach from the researcher end to implement StudyFinder and through the length of the research recruitment period, but then how we can accelerate the process to have studies taken down from StudyFinder as well. So that's coming in just a little bit, but thank you for that wonderful support of this being an effective recruitment tool and something that to get to your point, and I think Chalise in the chat is sharing a little bit about this idea of sort of removing these individual siloed registries and having this sort of serve as the encompassing registry across Penn State research studies. So Chalise, you are absolutely correct. There are several registries that have a place in certain particular departments or divisions based on the types of research that go on. So this isn't necessarily to replace those. Sometimes if there's, for example, one on healthy aging, that could be a way to more continuously reach out to those participants based on what they're interested in as it relates to healthy aging. So studies that maybe they've participated in that you within that repository have more steady communications with about upcoming opportunities. But this volunteer repository is much broader in bringing several types of categories of research back to those potential volunteers. And I love that you're getting at the diversity aspect, Kathleen. So we certainly will be talking about that as well. That is definitely a concern we have in CEnR and one that we are looking to really enhance from a health equity perspective.
Jen, there's one more question in the chat before you move on from that particular slide.
Sure.
From Carrie. She's asking, and I think she's referring to the language on this slide. How did you measure research awareness and likelihood of engaging?
Yeah, so great questions, Carrie. These are theoretical in nature. So when we think of any research methodology, these are our goals, right? That any research recruitment modality that we're implementing, that it's hopefully going to increase research awareness, and hopefully it'll be effective enough in engaging in future research opportunities. So these have not been measured. These are more philosophical goals of what StudyFinder could be, but measuring them are equally important and something that we need more data collection on of this as a tool. Some of those metrics are just not really being recorded effectively. The data tracking, there's a lot of gaps in it currently in terms of how someone finds out about the StudyFinder or volunteer repository. We have some traffic data, so how often they're going to the website and click data if they're clicking on a certain advertisement, but how that is then leading into not only recruiting and reaching out to the investigator, but subsequent enrollment in the project are metrics that we still don't have too much of a handle on, but certainly something that we're looking forward to capturing. So now we'll just take some time and talk about some pitfalls. So a few things that we're seeing is that, first of all, with this volunteer repository, the vision is to really create a quicker way for participants to find out about opportunities that match the interests that they've selected. And when this was originally implemented, the idea was that this volunteer repository would sort of sit within CTSI as a way for research teams to tap into potentially interested and eligible participants. So CTSI would sort of be the honest broker and reach out to those potential participants on behalf of the research investigator based on a research study they were looking to recruit for. There's a lot of potential, though, to take that even a step further and have this be a tool that automatically informs volunteers of study opportunities based on their selected interests that match those same categories that I shared previously when you do a search within the StudyFinder database. So that's something that we haven't realized yet here at Penn State, but something that we certainly have opportunity to do. There's also no current process to address undeliverable research team emails, which, believe it or not, we get a lot of those. So they get routed to our CTSI inbox through StudyFinder. And what that means is if a volunteer clicks on your study and they want to learn more, the email that's listed, if that individual is no longer part of Penn State, we find out about it through this undeliverable that they also end up receiving. So right now, it's sort of a tricky process to find out who else on that research team might be an appropriate person to contact. So one thing that we are suggesting in our revamp is to have more than one research team email posted. So a backup email that at least we can have on the back end. If there is undeliverable, it can automatically get routed to that backup email. We're also finding that not all study descriptions within StudyFinder database are health literate. And when I say not all study, I'm being very generous with that. There are several studies that are posted that are certainly not at the appropriate reading level of some of our participants. And when we're thinking of potential participants, this is the broader community. So we need to make sure we're really thinking about this with our health equity hats on in terms of the best ways to make sure this information is digestible and consumable by the broader audience. There are definitely some resources that are embedded within CATS and StudyFinder to create some more lay versions of your study description, but we're hoping we can take it a step further when we think about this version 2.0, which I'll present in just a little bit. This also comes up a lot, and Jody, this is what I was referencing, this need to submit an IRB modification to have the advertisement removed. This is a big barrier to study teams. They don't even know that this is a thing that they need to do. We have many that just email our CTSI inbox and say, I'm done recruiting, can you take my ad down? And unfortunately, currently, it's not as easy as that. They are requested to submit an IRB modification. So we're hoping we can have some conversations about how to create some sort of a researcher interface that allows for the swift removal of the study advertisement once recruitment is over. So maybe it's something that is linked to an expiration date that could be extended. We know recruitment windows sometimes get extended, but how can we really modify that on the researcher end so they don't need to go through the IRB application, modification process, which is just an inefficient process for everyone. Any other pitfalls that you all are seeing?
Yeah. And Jennifer, I can say as well that I know that Sarah Horn, who's our IRB director, and she's out today, or she'd probably be here. She was in those conversations when StudyFinder was first integrated into CATS. And the reason we integrated it into CATS, from my understanding, is because we didn't want the recruitment going up before the study was approved. And so the easiest way to do that was to have it integrated into CATS and have that StudyFinder page in there so that then it would be approved. Once it was approved, the study was approved in CATS, then it automatically showed up on the StudyFinder page like within 24 hours. And so the only way to get it down then is to come into CATS and say, no, we're not using StudyFinder anymore. And so that was kind of how that integrated process worked, so that we weren't having to then, they would answer the questions on the StudyFinder page and we didn't have to get additional information or like paper copies of what your advertisement would say in StudyFinder to review it, because we still have to review that information. And so I know that's how it was set up, but I'm sure Sarah would probably be willing to like have further discussions about if there's ways to improve that.
Absolutely, yes. And thank you for that background. And that is very helpful. Of course, we don't want anything to just be a recruitment method that's implemented without IRB approval. So that makes perfect sense that it starts in CATS, but I think there might be potential to see how we can close it out possibly within CATS through some type of more sophisticated programming that is based on sort of the expiration date. And, there are opportunities that we can look into. Sarah, thankfully, serves on our committee for StudyFinder, and we are meeting next week. So hopefully she'll be back for that, and we can touch base on this as well as some other things that, interface with IRB. Just want to take a moment and see if there's any thoughts in the chat. Lots of discussion about the lack of health literacy. And I like, Shalise, your suggestion to improve the screening before a participant reaches out, or maybe even having a way to more directly contact the researcher to see if they're eligible. Did you want to talk more about that, Shalise? What you were thinking there?
So I'm spokesperson for a bunch of different people in the department. But basically the thing that I find annoying is that when you get the email from StudyFinder, you can't just reply to the email, right? You have to find the email address in the email, copy it, forward the email, paste that email address, and then ask the person if they fit the study criteria, right? Like, are you actually a person with aphasia? If not, you're wasting my time. But this is also, like, I've got a lot of comments about the search function. So if we have more time about that, I've got lots of things to talk about. But other people were saying, like, can there just be a chat with the researcher? And I think that has to do with the fact that it's not easy to reply to those emails. And then the other thing was, can you just have a link in StudyFinder that just, rather than contacting the researcher, just say, you know, link to a screening survey, and then they hit the screening survey, it finds out if they're actually eligible, and then it emails the researcher, right? Like, these are the people that passed your screening survey. That would be great.
I love that. I think that's really smart. These are all excellent ideas. Did you want to talk now more about the search feature that you were having some, more suggestions on how that could be improved? I mean, this is a slide where we can throw in there everything that we can't stand about StudyFinder. And then we'll move on to the StudyFinder Reimagined. And that's sort of where we get to have fun.
Well, maybe some of these things are reimagined. So one thing that was brought up was having a separate section for compensation, so that if there's no compensation in the description, there's a way of knowing immediately whether there's payment or not. Having a section about time commitment. So if you're scanning, you don't want to have to read through the whole description to find out what the time commitment is. Let's see, be able to filter on, like, basic inclusion criteria, like age, or if they're right-handed, or if they're monolingual, or whatever. Just like those kinds of things for the search function.
I love those. Okay, we'll segue now into what this might look like in the future. Keeping in mind that, this will be some significant programming revamping, so that always takes some time. But the purpose of really today's talk is to get a sense of what are all the things that we might be able to do that will make StudyFinder a more effective recruitment tool for you. So we're thinking through the lens of inclusive recruitment and also improving health literacy, as in terms of what CEnR can really contribute to this revamp. So let's talk about inclusive recruitment a little bit. So we do a lot in CEnR to meet underrepresented communities where they are, to share research opportunities. What you're seeing over here on your left is the Lion Mobile Clinic. This is led by Dr. Mike McShane at University Park, and he brings service and education and primary care services to rural communities across the State College catchment area. So some of our underrepresented rural communities, we know that there's well-cited barriers to research participation related to connectivity issues, barriers to transportation. So we go out on the mobile clinic, and you can see one of my wonderful colleagues, Paula Moody, in this picture, along with another wonderful colleague, Holly Dolan from the Penn State Cancer Institute. And so Holly is sharing her research opportunity with potential participants that are from this rural community that's often excluded from research, to learn about this colorectal cancer study that is being conducted. But Paul is also there to share other research opportunities and the StudyFinder volunteer repository flyer. Now, we know again that since technology could be a barrier, we have iPads that we bring along with us and can actually sign people up for the registry while they are there, learning about other opportunities, or maybe receiving a flu vaccine or getting their blood pressure checked. So it's an effective way to sort of have that outreach in those harder to reach communities. We also know that we can do this very effectively in our urban counterparts. So while there may not be the same connectivity barriers, there's other barriers to finding out about study participation. Also specifically this sense of lack of trust, or making sure that we are demonstrating trustworthiness in some of these communities where we know things have gone really quite badly in the past. So building those connections, a big part of what CEnR does is really trying to enhance the connections and the footings that we have in these communities, whether it's racially diverse, older adults, those that live in these rural communities. So all aspects of diversity. How can we really get the research opportunities into the hands of those individuals so that not only can we make research work for everyone, but ultimately healthcare will work for everyone because it's representative. So that's some of the work that we do in CEnR, and we're a tiny but mighty team, so we can't be everywhere all at once, and that's one of the reasons why we wanted to hold this session so that we could really increase the opportunity for all of you to share about the volunteer repository and the research activities that you're doing. We also see opportunities to really enhance the demographics that are collected, specifically related to race and sexual orientation and gender identity. This is work that CEnR has spent a lot of time in, specifically in the SOGI data collection, as a way to really enhance the screening of potential participants from the LGBTQ+ community. We also have some updated race, which I'll show you on the next slide, from federal guidance. Why these variables are really important is because it lets us know, who is StudyFinder actually working for? Is it just working for the white males that make up most of clinical trials across our nation? Or is it actually effective by some of these more outreach and community engaged approaches to increasing representation in research? We're also looking to adapt study communications that are really matched to user preferences, and I'll show you how we're piloting that now. And then thinking of expanding these areas of interest for more relevant study matching. And I think some of the wonderful ideas that have already been shared to stratify the data even further so that we can really make sure someone who is actually interested in the study and is pretty close to being eligible, or if not, definitely eligible, to reach out to the study team. Just to share a little bit more in depth about the race and SOGI guidelines. So under federal guidance now, and this is just implemented earlier this year, there is now one question that gets at race and ethnicity. So this is the gold standard and is slowly being implemented across funding agencies as well as at the institutional level. So CEnR has done our part, and we continue to do our part to get the word out that this now includes Middle Eastern and Northern African as a category on the race question. And it also includes Hispanic or Latino instead of that being sort of a second question. So this is the new guidance. We encourage all of you to also implement this in your data collection demographic information that you get from research participants, but certainly something that we want to make sure that we're doing for those volunteers that sign up for our registry. And then these are all hyperlinked. I'll make sure that you have access to these slides, but you'll see on your right, this is evidence-based SOGI data that we have created a screening tool for. We had a CEnR session on this, which is also hyperlinked. We would love to hear your feedback on this tool and its implementation in your research. This was really in response to on-the-ground research teams that were really having a tough time not knowing how to appropriately and sensitively collect some of this information because it had research implications. For example, asking, are you currently or planning to become pregnant in the next 6 months? That has a lot of implications depending on a person's identity. So making sure that we're asking this and being incredibly thoughtful and intentional. And like I mentioned, this is evidence-based. We worked with local, regional, and national experts in the LGBTQ+ space to develop this tool, but we realize it's evolving. The LGBTQ+ community is evolving. And if there's any changes that you see on it that we can implement to make this even more inclusive, please do let us know. Any questions on the updated race and SOGI guidelines? And I guess my first question to you is, was anyone aware of these changes that have been made? For your studies, how are you tracking, how are you collecting this? So like, for example, for NIH, there are recruitment milestones that you have to collect and report back to NIH. And this is in the process of being implemented in those reporting milestones through a contact we have at NIH. Are you collecting this up front when your research participant signs up for research? Like, is demographics a big thing that you collect in your research, or not necessarily? And as mentioned, the importance of collecting this is to really ensure that the way in which we're reaching these underrepresented communities actually matters, because it matters on who's signing up for studies and what those outcomes look like for generalizability purposes. So this is one way to make sure that we're showing our health equity, that we're making health equity the center of this recruitment tool by having a very inclusive way in which we ask these demographic questions. Other ways that we can envision StudyFinder enhancing engagement is there's opportunities, and more there's this growing approach to research known as community engaged research. So it's not necessarily a study design, it's really just an approach that elevates the voices of community as true partners throughout the research process. So we advise a whole lot on community engaged research projects across Penn State. Funders more and more are having call for awards that support this idea of engagement with non-traditional research partners. And so why not have StudyFinder be an opportunity to identify future community partners on research studies? If we have research participants that go through research studies and have a good experience, oftentimes those are the very community partners we end up seeing on future projects. So it might be a really nice way to share not only what it means to be a research volunteer, but what does it mean to be a community partner on a research study, and having opportunities for folks to share their interest in those roles is something that could really be an enhanced opportunity through StudyFinder. Also, there's opportunities to really have more neurodivergent approaches to the ways in which study opportunities are shared. So I know there was some talk about having some images or information about compensation, or more specifics about the study that the volunteer can learn about, and that's exactly what we're thinking. So when an email gets sent out to a potential participant based on a study that they have selected, or at least a topic area that they've selected they want to know more about, wouldn't it be really nice if instead of seeing just the text of what the study is and who to contact, that it really breaks it down in a very consumable way and a way that supports neurodiversity? So having images along with text, having simple information that's readily available. So, maybe it's using icons. Some of our other CTSAs have done this really effectively, where, it talks about the main things that's required in the study, what the main eligibility criteria looks like, what compensation will be provided, and those are all actual icons, and then it will list the information. So some type of more appropriate approach that really is responsive to some of our neurodivergent volunteers. We've had some initial conversations already with this idea of linking within the Penn State My Health Patient Portal. This really is a missed opportunity currently, because a lot of the other CTSAs that we spoke with have this directly implemented within their own electronic health record database. And so if a participant wants to find out about a study, they also maybe we're just at their doctor's office, they go into their patient portal and find out that they now have diabetes. In that same portal, they can go and find out research opportunities related to diabetes care. So that's something that we're looking into to sort of expand at least the patients that are from Penn State. Although getting at the inclusivity piece of this, 80% see a primary care provider, 20% don't. So we want to make sure that we're reaching out to some of our federally qualified health centers and other community centers to also reach these potential volunteers. And then this idea about language accessibility, this really does come up in lots of the work that we do, specifically for a study that we currently are participating in that is really seeking to specifically address an aspect of diversity for a parent trial. We very early on learned that in order to enhance the enrollment of Hispanic Latinos in the project, we had to actually translate the entire study into their native language, which is Spanish. These were older adults who oftentimes migrated here at a later age and didn't really have a need to fully learn English, which was an existing eligibility criteria. So we had the funds and the time to be able to, and of the resources as well, in terms of a diversified study team, to be able to offer this study in Spanish. But when we're thinking of offering research opportunities in Spanish, or the volunteer repository itself in Spanish, we're at risk of not having actual studies that are in Spanish. And that's sort of a larger issue as we think of how can we enhance diversity across our university by not only investing in more research infrastructure to support the onboarding of a more diversified workforce, leveraging community health workers as community connectors to research studies, who oftentimes are from that community we're intending to reach, who speak the same language, and also, just leveraging our community partners in general to reach study participants. So we're not at a point yet where I don't think in this next revamp we can expand upon the inclusion of different languages unless we have opportunities to really collect data on the studies that exist that are also offered in other languages. If we see that there's enough of them, then perhaps that could be another piece of the database that potential participants can access that second language. So something that is certainly a vision of ours. And again, as we think of really expanding overall efforts to have multiple languages conducted in research studies, is something that we're looking into. What are some other ways that, if we're thinking of our pipe dream and wish list here, how that we can enhance engagement?
And real quick, Jen, while people are thinking and writing that in the chat, we got some feedback about the SOGI guidelines, and people were saying that they're collecting the information but weren't really aware of the specific guidelines and how they've changed. So I'm glad we were able to talk a little bit about that. But Dara asked, are these guidelines for adults or also children?
That's an excellent question. When we developed them, they were for adults. When we talked with our experts, there wasn't any distinction among adults versus children when we captured what each of those options should be. But that's certainly a very important question as we think of LGBTQ plus among our youth and adolescents. So I will get back to that when I reach back out to our team of experts to find out, if there's any differentiation or a more appropriate way to ask these questions for a younger audience. But I think that's an excellent point. And Ben, I love your idea to see how StudyFinder could be advertised on social networks. I don't think we're doing enough of that, getting the word out. It's oftentimes patients, find out about a new disease that they're diagnosed with, and then they're looking for opportunities to, find clinical trials that match that diagnosis. So that's usually through a Google search, and then StudyFinder comes up through Penn State. So yeah, how can we get the word out to, make this more readily available? And I think the volunteer repository could really be a beautiful way to do that, as long as we can make sure that there's a swift, swift identification of those opportunities.
Hi, Karen. I'm Kylie. I don't know if Morgan told you. She's not able.
Yes, and I love the images and icons. Absolutely important for several groups and populations that we're trying to reach. So we're certainly thinking with that. So in making StudyFinder work for volunteers, really the most important thing is this idea to have these opportunities automatically funnel to their inbox, or whatever way makes sense. But typically, since this is an online database, it would be electronically that they would find out about those volunteer opportunities based on the selected interests that match what they had designated when they became a volunteer, and also based on their preferences for communication. So I apologize, these images to your right are a little bit blurry, but the first one is an email that we did send out to our existing volunteers, which is now growing to be well over 1,200 at this point, I believe. And really to be able to let them know that being a volunteer is a really important thing. It helps change science. It helps, really accelerate medicine. But that this volunteer repository is essentially still new. We're still trying to figure out what works. So in order for this to be as community driven as possible, we developed a survey to really capture their feedback on how often do you want to be contacted about studies? Do you want to have it every time a new study comes out, you get an email? Do you want multiple opportunities in one email? And so we're piloting that data now just to get a good sense of how we should implement these communications. And maybe it can be at the individual level. Maybe there's opportunities to do that at the individual level for these preferences. So we're still kind of figuring that out, but it's a good place to start by going right to those individual volunteers and finding out what works for them. And then the next image is an example of a flyer of research opportunity, and the flyer that's downloadable in the email itself. When we were looking to recruit folks who had serious difficulty walking or climbing stairs. So this was for actually a strength training based study in older adults. And we can take some of the content of this and use it as a template for future opportunities that volunteers find out about. What I like about this is it does kind of succinctly state who can participate. It gives access to the flyer, which has a lot more information about compensation and more about study visits and what the study looks like. So maybe that's the model moving forward, that this would be the automatic email that would go out to participants. Maybe we can state it a little bit more succinctly, but this kind of gives you a flavor for the capabilities we might have in making those research opportunities more automated. And then in making StudyFinder work for you, we really want to improve the ease in which you can translate your study advertisement into lay language, since we've talked a bit about how we're just not really doing that effectively. Because it turns out it's going to increase your research participation. If a volunteer looks at your advertisement and has no idea what they're reading, they're going to be obviously less likely to sign up for your study. We will also want to employ more sophisticated tracking so you can find out how effective your ad is on StudyFinder in recruiting and enrolling study participants. Also, some more sophisticated programming so that by the time a participant gets to you to email you, as we talked about today, that they're actually probably eligible and might be a candidate for your research. And then thinking through, as we already discussed, an easier and swifter way to remove an advertisement once enrollment is complete through StudyFinder. And then I just want to dangle this idea of going a step further. So can we envision StudyFinder as a place not only for research recruitment, but also results translation? And this is something that really is just not done well enough. And that's a national issue. It's not just isolated to Penn State, but this idea of returning results back to study participants or the broader community is there's just a huge gap in how to do it and resources to enable the opportunity to do it. But we're really at risk of decreasing the trustworthiness in the research process by not doing it. We held focus groups about a year ago with several participants of research at Penn State, past and current, also the general public, on the best ways to share results dissemination. And we found out, particularly for the participants of research, they actually thought that they would find out about the study results. And we're not talking about individual return of results. That's a whole nother can of worms, but really just the aggregate return of results. That didn't happen. There was really no study communication. And many of these patients were part of, a year-plus long research study that required a lot of study visits and commitment on their part. And they obviously were doing it to improve a condition for themselves, or maybe for a family member, or, to give back to science. But them not being included in what the findings were really didn't leave the best taste in their mouths. And that was shared broadly across the groups that we interviewed. So you'll see this infographic on your right that really shows the beautiful cascading effect when we do effectively dissemination. So not only does it improve volunteers, participants' understanding of research findings, it helps to really continue to build and nurture that trust in health research. This allows us to continue to strengthen those community academic partnerships so that researchers and research participants can keep working together. There are some teams that do this really well. And they're sort of the outliers across Penn State in keeping their participants informed. And that's usually where those registries are generated from some of these departments. They have that good communication back with those research participants who then want to keep coming back to more research studies. So it ultimately increases research study recruitment and further participation. Stephen, I'm going to pass to you to talk a little bit about some of the innovation with artificial intelligence that's being done at Research Match in terms of translating some of what we find in research to a lay audience in a much more efficient way.
Yeah, absolutely. So I recently had the pleasure and the privilege, along with Paula, to attend the Johns Hopkins Symposium on Digital Approaches to Recruitment Strategies. And one of the things that we learned is Research Match actually utilizes ChatGPT as a way to summarize their lay summaries and sort of disseminate it across the public. So they are very specific with their engineering prompts. Obviously, AI is still a bit of a, tool that we're learning how to use, but they actually found that by creating the correct prompts and being consistent in how they sort of generate these results, they're able to generate more easily accessible lay summaries to the general public and even translate them with a fairly accurate and consistent accuracy. So it's just, one of those things where there's still a lot of research that needs to be done, but it's definitely a step in the right direction. And it shows us how we can use other tools in addition to like our researchers and like, our institution to sort of find ways to reach the public where they're at and make things a little bit more accessible for them while also removing the burden on researchers of having to do all this work manually themselves. So.
Yeah, thank you so much, Stephen. I love this idea. I'm picturing in my head, researcher Dr. Smith, and here's his research opportunities, and here's also some past studies he's done, and here's the lay results. So when a volunteer is going to that page or to that area of research opportunity, they're seeing that this investigator wants to give back those results. And I wholeheartedly believe that will assist in a volunteer wanting to be more inclined to participate in research, because there is that give back, and that can help patients potentially make more informed healthcare decisions. It helps improve their own health literacy, and it really has this beautiful cascading effect. So certainly something that we're keeping the pulse on as AI really infiltrates more into health and research. This is one really positive way in which we can enhance dissemination and accelerate those findings back to community. We are close to time, so if you have any more ideas on how StudyFinder can work for you, please do share them. We have our email here. I will make sure these slides go out. We have an evaluation that we're going to pop in the chat. We do very much listen to your feedback, and there's opportunities to talk a little bit more about ideas you might have in that evaluation. So please do check that out. We'll close with any final questions you might have, and then we'll stop right at the hour. Appreciate you all attending and the wonderful ideas that you shared. And we will be in touch with an update as we move towards realizing this Vision 2.0. Thanks, everyone.